Frozen shoulder is an musculoskeletal disease. Look at this picture shows that normal shoulder joint and frozen shoulder. Then ultrasound findings detect inflammation and fluid accumulation. Look at this. Then CT scan, MRI to assess soft tissue involvement, X-ray findings to rule out fractures or arthritis. Look at this. A detail going on. Introduction. Frozen shoulder, also known as adhesive capsulitis, is a painful and disabling condition that affects the shoulder joint, causing stiffness, pain, and reduced range of motion. It typically develops gradually, worsens over time, and then resolves often within 1 to 3 years. The condition can significantly impact daily activities and quality of life. Definition. Frozen shoulder is a condition characterized by inflammation and fibrosis of the shoulder capsule, leading to pain, stiffness, and restricted movement in the glenohumeral joint. It is commonly associated with the thickening and tightening of the joint capsule, restricting normal shoulder mobility. One primary idiopathic frozen shoulder develops spontaneously without an identifiable cause. Two, secondary frozen shoulder occurs due to underlying conditions such as trauma, surgery, diabetes, or prolonged immobility. Causes. 1. Prolonged shoulder immobilization, example after surgery or injury. 2. Inflammatory conditions, example rheumatoid arthritis. 3. Autoimmune disorders. 4. Diabetes mellitus. 5. Thyroid disorders, hypothyroidism, hyperthyroidism. 6. Cardiovascular diseases. 7. Neurological conditions or disorders, example stroke, Parkinson's diseases. 8. Post-surgical complications, example mastectomy, cardiac surgery. Risk factors. 1. Age. More common in individuals aged 40 to 60 years. 2. Gender. More prevalent in females. 3. Chronic illness. Diabetes, thyroid disorders, cardiovascular diseases. 4. Shoulder injury or surgery. 5. Prolonged immobility due to conditions like fractures or stroke. Complications. 1. Persistent pain and stiffness. 2. Permanent loss of shoulder mobility. 3. Muscle atrophy due to disuse. 4. Increased risk of recurrence in the other shoulder. 5. Functional disability affecting daily activities. Pathophysiology. Frozen shoulder, also known as adhesive capsulitis, is a condition characterized by pain and progressive loss of shoulder movement. The exact cause is not always clear, but it involves inflammation, fibrosis, and thickening of joint capsule. Below is the step-by-step pathophysiology of frozen shoulder. 1. Initial inflammatory phase. Synovial inflammation. Trigger can be idiopathic or secondary to trauma, surgery, prolonged immobility, or systemic condition like diabetes. Inflammation, the synovium of the clinohumeral joint becomes inflamed, leading to increased vascularity and infiltration of inflammatory cells. Example, macrophages, lymphocytes. Pain onset. Synovial inflammation leads to pain and discomfort, often without major motion restriction initially. 2. Fibroblastic proliferation, capsular fibrosis, fibroblast activation in response to inflammation, fibroblasts proliferate and produce excessive extracellular matrix compounds including collagen and fibrination. Capsular thickening. The normally flexible joint capsule become thickened and stiff due to excessive collagen deposition. Then loss of synovial fluid. The production of synovial fluid decreases, reducing lubrication within the joint. 3. Formation of adhesions. fibrosis progression, the capsular continues to stiffen with adhesions forming between the humeral head and the surrounding structures. Restricted range of motion. Thickened bands of tissue restrict movement, leading to significant stiffness and difficulty with active and passive motion. Pain reduction over time as inflammation decreases, pain may subside, but stiffness remains. 4. Resolution or thawing phase is gradual recovery. First, capsular remodeling. The fibrotic tissue undergoes slow remodeling and adhesions may gradually loosen. Region of mobility. Shoulder range of motion begins to improve. The full recovery may take months to year. Persistent stiffness. Some patients may have residual stiffness despite improvement. Signs and symptoms. 1. Gradual onset of shoulder pain, often worsening at night. 2. Stiffness and limited range of motions. 3. Difficulty performing daily activities. 4. Muscle weakness due to disuse. 5. Pain that may radiate down the arm. A diagnosis. 1. Clinical examination assessing range of motion and pain levels. 2. Image studies. A. X-rays to rule out fractures or arthritis. B. MRI to assess soft tissue involvement. C. Ultrasound detects inflammation and fluid accumulation. Nursing diagnosis. 1. Acute pain related to joint inflammation. 2. Impaired physical mobility related to joint stiffness. 3. Self-care deficit related to pain and restricted movement. 4. Risk for injury related to muscle weakness. 5. Disturbed sleep patterns related to nocturnal pain. Medical management. 1. Pain management, non-steroidal anti-inflammatory drugs, corticosteroid injections. 2. Physical therapy, strengthening and stretching exercises. 3. Hydrodilatation, injecting fluid into this joint capsule to improve movement. 4. Surgical options. A. Manipulation under anesthesia, forced movement to break adhesions. B. Arthroscopic capsular release, minimally invasive procedure to release tight tissue. Nursing management. 1. Encourage gentle, passive and active range of motion exercises. 2. Apply heat or cold therapy to reduce pain and inflammation. 3. Educate patients, no pain management techniques. 4. Assist with activities of daily living to prevent further complications. 5. Monitor for signs of complications, example worsening pain, joint instability. Treatment options: 1. Medications, NSAIDs, corticosteroids, analgesics. 2. Physical therapy, strengthening exercises, joint mobilization. 3. Heat and cold therapy, reduces pain and stiffness. 4. Hydrodilatation, injection of saline to expand the joint capsule. 5. Surgery, if necessary, arthroscopic release or manipulation under anesthesia. Psychosocial medicine: 1. Patient education, explaining the conditions, treatment plan, expected recovery. 2. Cognitive behavioral therapy CBT, helping patients cope with chronic pain. 3. Support groups, encouraging peer interaction for emotional support. 4. Relaxation techniques, meditation, breathing exercises to reduce stress. 5. Encouraging independence, assisting in modifying activities to maintain daily functionality. Prevention: 1. Engage in regular shoulder mobility exercises. 2. Avoid prolonged immobility post surgery or injury. 3. Maintain good posture and ergonomics. 4. Control underlying health conditions, example diabetes, thyroid disorders. 5. Seek early treatment for shoulder pain to prevent progression. In conclusion, frozen shoulder is a debilitating condition that can significantly impact daily life. Although it is self-limiting in most cases, early diagnosis and appropriate medical and nursing interventions can help reduce pain, restore function, and improve quality of life. Preventive measures and psychosocial support are essential for optimal recovery and long term well being. Thank you. Have a nice day.